We're so excited to provide these no-cost institutes to folks from all across the Pacific Southwest Mental Health Technology Transfer Center region. A really intensive experience to dig in deep and get thoughtful and reflective about our practices, creating trauma-informed and eventually healing-centered systems for mental health in the workplace.
Learning opportunities like these are really important for mental health professionals because often people who come to the work of mental health are not necessarily prone to do their own kind of self-reflection and emotional intelligence work. We know that compassion fatigue and burnout is very real for folks in this profession.
What are we feeling in the room? And being mindful that all feelings are welcome.
Implementing regular check-ins in whatever your workspace is.
Knowing what you feel and how you want to feel.
Superiority complexes, a feeling of unworthiness in your workplace.
One important aspect of emotional intelligence that we've explored today is the ways that systems of oppression and privilege intersect with our ability to be of service.
So we're a community-based mental health provider. We're a nonprofit, so we do therapy, case management, supportive services for children and families. One thing I've really been trying to work on is really developing a workplace where our folks feel cared for. If we can keep people healthy as providers, it's going to impact the people that we serve in a great way. And if we can't stay healthy, how can we help other people become healthy?
So we start off with really understanding the basic building blocks.
The conversation around trauma-informed systems, do we know where did that system actually build upon?
We then think about what that can look like for us as people and then us as professionals.
I work for a county office of education as a director. The ongoing effort to get better and better at ensuring that each and every employee is healthy and well, and that we're in a good space to be able to provide the level of support that our students need and that they deserve.
I hope that participants leave this with a better sense of feeling comfortable on how to talk with children and staff after crisis events.
So psychological first aid is something that's usually done after a major event, and it's provided broadly to all those who are impacted.
Even in the absence of a major crisis event, children show up at school upset about something that's happened in their family or in their community. So every day individuals should be prepared to help someone deal with a distressing situation.
The next portion moves into what does that look like from an organizational system, having small group inquiry for folks to learn from and with one another.
So you build collaborative and reflective decisions around how folks would like to respond or what they would need in event of a crisis, so that when that crisis happens, you have collaborative decision making that's gotten you to a shared response.
It's not enough for us as individuals to be emotionally intelligent, but to make sure that what we design in terms of our systems, our curriculum, actually reinforce and reflect that emotional intelligence as well.
The responsibility of folks who are working in mental health and community-based organizations and schools to really embody emotionally intelligent leadership.
And then commit to practices that we want to integrate moving forward.